Well, good morning, everyone. My name's Catherine Bennett, and I've been a nurse practitioner working in long-term care now for over 10 years. So my presentation today is based on my 3 long-term cares. They're all in the Central Lynn. I have Bradford Valley that has 246 residents. Bloomington Cove in Stouffville has 112 residents. Now, Bloomington's a little bit different because every resident in that home has a diagnosis of dementia. I also have Cedarvale Lodge with 60 residents in Keswick. So in preparation for our discussion this morning about the changing resident profile in long-term care, particularly around mental health, I've taken some direct quotes from our residents, families, and staff that are at these 3 long-term care homes. So when you're talking about frontline perspective, you can't get any more frontline than our PSWs. And this PSW in particular, Lisa, has 40 years of experience working in caregiving. So I said to Lisa, over your long career, what are your challenges? What do you see changing? And her response was, the resident care is getting heavier and heavier. The residents just want me to stop and chat when I'm delivering nourishments. I want to stop, I want to listen, but I'm just so rushed. So I don't think there's any doubt that there is an increased staff workload at the front lines. Certainly at Bradford Valley, there's a large resident turnover. They did 100 admissions in 2013. The residents are also more complex. Of my 418 residents, 85% have a diagnosis of dementia, most of that being Alzheimer's disease. 16% of my residents have a psychiatric diagnosis of bipolar disorder or schizophrenia. The average age is 85. When I look at the cognitive performance scale, I see a 10% increase in the number of residents with severe cognitive impairment in the past year. So also from the PSWs, and a PSW said to me, Mr. B was very agitated. He twisted my wrist when I was trying to redirect him away from another resident. That certainly is reason for concern. One home, despite having monthly gentle persuasive approach education, still had a 14% increase in their number of staff workplace injuries sustained during resident care in 2013. When I look at the number of residents with an aggressive behavioral score of 4 or more, meaning increased frequency and increased and severity, there was a 4% increase in those residents with a score of 4 or more in the past year. So Mary's an RPN. She said to me, I seem to spend most of my time giving out medications or trying to intervene when a resident's behavior is escalating. Mary's right. The residents that I look after are increasingly complex with many multiple comorbidities. Over 80% of my home's residents have 9 medications or more. Over 40% of my home's residents are receiving antipsychotic medications without a diagnosis of psychosis. So Tina, as a DOC, and I could have had about 15 slides from the DOCs because they have a lot to say and they face a lot of challenges, but I narrowed it down to Tina. And Tina said, I spend many hours a day responding to family POA concerns and providing them with education on dementia and behaviors. We often do not have the frontline staffing to meet their care expectations. And I think there's no doubt that families in POAs certainly do have increased access to healthcare information, usually via websites on the internet. And although that can be very beneficial and helpful, sometimes that information that they're accessing is just not valid or accurate, and that causes some challenges. So Sonia is the daughter of a resident that I've cared for, and she said to me, I'm very worried about my 90-year-old mom being injured by another resident here. What are you going to do to ensure that she's kept safe? And there is reason for concern. 39% of my home's residents display behavior symptoms affecting others, i.e. verbal, physical aggression, or socially inappropriate behaviors. One particular resident, the police were called 5 times, and there were 4 hospital transfers in the span of less than 3 weeks, all for very high-risk behaviors such as throwing chairs, striking out at staff and co-residents. The CIS reports, or critical incident reports, in my homes have increased on a yearly basis. Dr. G is a medical director that I work with, and her comment was, my background is a family practitioner without the expertise in psychiatry. It's a challenge to find medical resources required during a crisis situation. And it's true, at one home, there's between the time of referral and the time of admission to a mental health facility for a 60-day assessment, the wait time is well over 30 days. And that's a long time to wait when you're in a crisis situation. Dr. G also said there's no educational curriculum targeting the skill set for medical directors in long-term care. It really is learn as you go. So we've talked a lot about the challenges, and certainly there are many, but I'd like to present just some ideas that I've seen in my home, in my homes that I really feel have made a positive impact for resident care. Certainly we've talked a lot about staff education, the GPA pieces. We found it particularly helpful for our RPN staff to have some extra leadership training. Oftentimes they haven't had a lot of formal education in leadership, and they usually are the care leaders in their home areas. We've certainly utilized BSO. In my area, we use the mobile response units. We utilize high intensity needs. We tried to build a very strong relationship with our hospital, the GEM nurses, and the nurse-led outreach teams. Bloomington Cove has had a very unique special services committee. Basically, there's community members such as NLOT, the RNAO, Best Practice Coordinator, the Alzheimer's Society. So on a quarterly basis, everyone comes together around the table at Bloomington. They talk about their programs, what the successes are, what the challenges are, and we try to come up with very, very practical, doable ideas that will really enhance the care for the residents at Bloomington. Telemedicine, I'm very fortunate to have the OTN or telemedicine equipment at all three of my homes. We use it a lot for accessing medical consults, but we are trying to really expand our utilization for mental health issues. So just this past Friday, we had a gentleman who has been an inpatient twice in a mental health center. He's also had one-to-one staffing for many, many months. We were able to arrange a consult with a psychiatrist at Ontario Shores, where the psychiatrist was able to speak to the resident and ask him questions. We did a case presentation, the family were present, the staff were present, and at the end of the 30 minutes, we had come up with a treatment plan or a care plan for this gentleman going forward. I also think that it's very important to build the capacity, particularly nursing capacity in long-term care. Integrating an advanced practice nurse into long-term care, such as a nurse practitioner, such as myself. I'm frequently asked to assess residents and provide treatment for delirium, for pain, for episodic conditions. And certainly having an advanced practice nurse in long-term care, you're going to build capacity with the nursing staff and really make sure that the residents are receiving evidence-based care. All my homes would like to enhance their in-home behavioral care RN for case management and better coordination of care for our residents with challenging behaviors. Certainly we have a multidisciplinary approach. We try to focus on quality of life. Our programs department has introduced Montessori and doll therapy. Our dietary department has introduced a very successful pleasurable dining program. So also Bradford Valley, they really found that there was a real challenge with a need for family education. So they partnered with the Alzheimer's Society. So now we have a Alzheimer's Society caregiver support and education group on a monthly basis. Bloomington Cove, too, has just recently started quite an innovative program. It's an ethics program, and they've been very fortunate to have the assistance of Dr. Michael Gordon from Baycrest. So what was happening was we were finding that there was often incidents where we couldn't reach a consensus between the care team and the family about maybe what was the best treatment or care plan for a resident. So we're really hoping that this ethics program will help strengthen our staff communication and problem-solving skills. And last but not least, political engagement. All my homes have invited their MPP to tour their home. In fact, one home had the Minister of Health, Deb Matthews, for lunch just before Christmas time. So I think it's important that the politicians and the decision makers are seeing what's really going on in long-term care. So in conclusion, I really had the good fortune of working with care teams at my homes that are certainly very dedicated and also very, very resourceful. And the ideas that I presented today really have been their initiatives that I feel are making having a huge benefit for the care of residents on a day-to-day basis. Thank you.